Andhra Pradesh Chief Minister Jagan Mohan's vision towards increasing COVID cases is to provide free treatment in the state's government hospitals for COVID patients. The Chief Minister said this is an essential aspect and every hospital which is empaneled with the government for exclusive COVID care will be providing free treatments to the COVID patients. The hospitals are equipped with the resources and will ensure beds and proper treatment to the patients, the Chief Minister said. He further said free treatment will be provided in Arogya Sri as well. Other than this, hospitals that are not empaneled in Arogya Sri will also have a rate card fixed and is clearly mentioned in UN 77 and UN 78. He mentioned that no hospital is supposed to charge anything more than the amount mentioned in UN 77 and UN 78.
Another important aspect is the entire treatment for COVID patients is free of cost. And the rate card is clearly spoken about in GO number 77 and GO number 78. Rate card is fixed and no hospital is supposed to charge anything more than that.
Former Union Minister and veteran Congress leader Matan Singh has died due to COVID-19. Matan Singh tested positive for COVID-19 on April 22nd and breathed his last in a hospital in Delhi this morning. He was 58 years old. Matan Singh worked closely with former Prime Minister P.V. Narasimha Rao and served as a union minister in his government. In Assam, Matan Singh was well known as a TV tycoon. He introduced Assam and the Northeast to satellite television by launching the region's first satellite news channel, Northeast Television, popularly known as NE8, in 2003. He was elected to Rajya Sabha from Assam in 1992 and served as Union Minister of State in Parliamentary Affairs from 1994 to 1998. Nagaland government has directed all private hospitals to provide treatment to COVID-19 patients as per the standard operating procedures and reserve at least 50% of their bed capacity in normal wards and ICU for treatment of COVID-19 patients. In an order issued in this regard, Health and Family Welfare Principal Secretary Amardip Singh Bhatia said district task forces would ensure compliance of the directive. Projections made for the number of ICU beds, oxygen-supported beds and ward beds were discussed at the state-level COVID war room, and it was felt that private hospitals should reserve at least 50% of their beds for treatment of COVID-19 patients to meet the emergency requirements. The need for mobilizing resources available in private hospitals to ensure effective management of COVID-19 patients was also discussed with representatives of private hospitals on May 3rd and 4th. Indian Air Force plane flew in with equipments meant for oxygen plant from Ahmedabad and landed at Dimapur Airport today. Compressors and dryers were brought for PSA oxygen plants for the state. Nagaland's total caseload crossed 15,000 mark yesterday after 287 fresh COVID-positive 19 cases were reported from the state. Superintendent of Police East Khasi Hills has issued an advisory on financial cyber fraud. The advisory states that a financial cyber fraud in the name of medicines for the remedy of COVID-19 has been doing the rounds. The police have advised public not to fall prey to such gimmicks by fraudsters. The bank account of the fraudsters are attached with the Bank of India under an account named Cipla Foundation Limited. All are advised not to entertain such advances.